Breast cancer is a serious and potentially life-threatening disease, but early detection can make all the difference in successful treatment. While it's important to have regular mammograms and checkups with your doctor, it's also crucial to be aware of your body and any changes or abnormalities that may be cause for concern. In this video, we'll explore 12 breast cancer early signs that you should never ignore. By understanding these warning signs, you can take action to potentially catch the disease in its early stages and improve your chances of a positive outcome. I want to welcome all our friends here to Body Care Guru, and I encourage you to watch this video for the life-saving tips I'm going to present. Now, here's the first thing that's really important to mention: breasts change. Every woman will notice that her breasts change shape and size a bit over her lifetime. This is entirely normal and nothing to panic or worry about. However, there are some changes and differences in how your breasts feel and their shape that can be early signs that breast cancer is developing. I'm going to go over a list of recommendations here to make sure that you're ahead of any potential development of breast cancer. Doing a self-exam. 1. Do a monthly self-exam. This is easier than it sounds and is best done a day or two after your period finishes, so your breasts are in their regular form and not especially sensitive, swollen, or different. 2. If you're past menopause and don't have periods anymore, just choose a regular day of the month to do your self-exam so you can remember it and be consistent. 3. Sit in a comfortable chair and feel your breasts with your hands, gently probing them. As you examine your breasts, check for lumps or growths which feel different from usual. You also want to probe your armpits as well to see if there are any irregular growths or lumps there. They may be as small as a pebble or small growth, so pay attention to details. 4. The main distinction of a cancerous lump is that it's likely to feel quite hard and not have pain. It will also not be shifting around, but will be fixed inside your breast. 5. The skin around a cancerous area may be red, patchy skin, feel bloated, or have dimples and strange shapes in it as well. In some cases, the breast may have a small gap or space that also feels odd, as if there is something missing in that area of your breast, and it's harder or has strange growths around there. 6. In addition, you want to pay attention to your nipples here. There are changes in the nipples that can also indicate breast cancer. They may feel thick or scaly and have some discharges or fluids coming out that are not breast milk. In addition, they may be red and irritated, and your nipples may be distorted in shape, or even inverting and turning inwards in a strange way. 7. A family history of breast cancer is something that you should also pay attention to as well, and it is important to get ahead of this awful disease by checking carefully. 8. If you feel a lump or a regular thing that worries you, please don't panic. There are many times that lumps may exist which are not an early sign of breast cancer, and may be things such as harmless cysts or less serious issues such as infections. There are other methods for doing a self-exam that can also be helpful. This is a slightly different way to do a self-exam from the previous one that is also highly effective. Here's how you do it. 1. Stand in front of a mirror with your clothes off and look in the mirror. Look closely for any malformed shapes or bumps on your breasts. This is the visual stage of the exam. 2. Next up, you will raise your arms up and look for any changes or defects as you raise your arms. 3. Then lean forward so your breasts hang forward and begin examining them for bumps, lumps, and abnormal shapes. 4. Start on one of your breasts and use your finger pads, not the tips of your fingers, to massage around the breasts, applying pressure and going in a circle to feel for problems. Start small and get bigger as you expand the circular massaging motion, feeling for problems under the surface. 5. After doing this for one breast, move to the other and repeat the same procedure. Remember to apply quite firm pressure and press down until you feel your rib cage, so you're checking all the way through your breast tissue. 6. If you feel lumps, remember what I mentioned earlier, not to panic, and to remember that most problems are not cancerous or life-threatening, even if they do cause discomfort and worry. Breast cancer or benign lumps and breast changes. Breast cancer symptoms show up differently for all different people, and early warning signs are not necessarily the same in all women. Unfortunately, there are cases where the early signs of breast cancer are not detectable, but generally there is some kind of indication. In the self-exam I pointed out above, there are various things you can watch out for that will help you detect early signs of breast cancer and be ready for the worst to take further steps, and a mammogram if you detect that something is amiss. Different symptoms show up for different people, and it's important to remember that all breasts are different in shape and size. Many women experience their breasts as being unbalanced or a bit lumpy, but this doesn't necessarily mean that there is any danger or sign of cancer. Your breasts may also change shape and size throughout your life, along with weight gain and weight loss, having kids, taking medications, and going through other health changes. The two most common causes of breast lumps are fibrocystic breast condition and cysts. Fibrocystic condition causes non-cancerous changes in the breast that can make them lumpy, tender, and sore. Cysts are small fluid-filled sacs that can develop in the breast. One of the best natural preventative medicines to stop breast cancer from developing is the plant moringa. This plant is also known as the drumstick tree, miracle tree, benoil tree, and horseradish tree. It's an ancient remedy that is antiviral and anti-inflammatory, and it helps prevent breast cancer from developing. Moringa can kill a very large percentage of cancer cells, about 70 to 86%, and bring them under control before they have a chance to mutate and spread. Moringa has the potential to act as a solid anti-cancer agent and decreases the proliferation of cells. It also triggers apoptosis to get rid of cell lines in different parts of the body that may be cancerous and have the potential to spread, whether these cells are in the liver, colon, or breast. The best part about using moringa as the solution is that it somehow manages to skip over the useful healthy cell lines without causing any serious toxification of the cells that are non-cancerous. Moringa may not be the full miracle cure to cancer that the world has been waiting for, but with the proper medical procedure, it is one of the best ways to prevent breast cancer and other cancers and keep your cells very healthy. I encourage you to check out our full video on moringa and its health and anti-cancer benefits, which we have here on the Body Care Guru channel. There are other recommendations to prevent breast cancer. In addition to the very helpful properties of moringa that I described above, the American Centers for Disease Control and Prevention, CDC, has other useful recommendations for how to lower your risk of breast cancer and prevent it from developing. In particular, there are some lifestyle and dietary changes you can make that will help you significantly. These include exercising regularly and maintaining a healthy weight, which means a healthy body mass index, BMI, for your age and height and weight group. Abstaining and stopping from drinking alcohol, or only drinking small amounts of it, such as red wine. Small amounts of wine can actually be great for your health, as we explain in our video here at Body Care Guru. Understanding fully the risks of taking certain forms of birth control and medications, which can sometimes increase the risk of breast cancer and other forms of cancer. Maintaining an overall healthy lifestyle that places a priority on your health, as well as keeping your stress levels as low as possible. The growth of cancer in our world is highly worrisome, and I don't blame you if you're feeling worried about the chance of having breast cancer, or how it's the 5th leading cause of death among women globally. These kinds of statistics would worry even the most stoic and calm person. Cancer happens when our genes that cause normal cell growth become mutated and cells grow out of control, forming tumors, abnormal growths, and dangerous mutated cells. It's not well known, but men can also get breast cancer and often also get symptoms such as lumps in their pectoral area. Although male breast cancer is much less common, it does still exist and is something that men should be aware and conscious of. A man can do a breast exam similar to those recommended for women in the methods I describe above. Thanks again for tuning in here to Body Care Guru, and please check out this video, which I'm sure you will like as well. Remember to drop a like and hit subscribe if you want more content like this. Take care, and remember to always put your health first. Have a great day, friends, and see you again soon.